Hi, my name is Rachel Clarkson and I went to CRGS all the way through up until my A-levels and undertook art, biology and psychology. I call myself the DNA dietitian because I enable my patients on Harley Street to eat according to their genes, really discovering their genetic variations and how that alters the way that they respond to food or the nutrients that you find within food. So it elevates their current health status and also their future health. So it's really thinking about things from a personalized kind of view rather than just general dietary guidelines that we know just aren't good enough anymore, especially when we have the science from places like Harvard University and the University of Toronto. So I work with the University of Toronto within my clinical practice, and I'm also working with their Harvard trained professor on some really exciting research around nutrition, genetics and fertility, so watch this space. But yeah, I just wanted to talk to you about how I really got here, and it didn't start with a clear view of what I wanted to do. I had no idea what I wanted to do when I was even doing my A-levels. I just knew that I was good at science, so I undertook a broad degree in biomedical science, which I really would recommend doing if you don't know what you want to do. It gave me a really great foundation to build upon. And then I went to undertake a nutrition science master's at King's College, and then I built upon that with a dietetics master's, which really allowed me to work with patients. So I initially started with a hospital job at Chelsea and Westminster Hospital, so that really meant getting on LinkedIn, making those connections. It was a tough process, especially when it was really hard to get into these hospitals in central London, but it just meant a lot of preparation, a lot of work experience wherever I could, to enable me to get that job, especially that first graduate job. It was quite tough, but it was worth doing. And then I decided after my first job that I really wanted to undertake private practice, because I couldn't work within the NHS with genetics and nutrition. It was just not something that they allowed at that time. So I really took it upon myself to get to where I wanted to be. So I actually booked on my first holiday from the job to go to San Francisco to a conference in personalized nutrition, because it was something that I was so passionate about, and actually managed to connect with some of the leading researchers in the world, and I held on to those connections, and I really didn't just take their business card, I followed it up with an email. I added them on LinkedIn and really used that connection to then build upon. So it was a really useful trip, and the connections I still am very close with today. Like I said, touching on the connections that I made in San Francisco, they almost became like mentors. So I would meet with them over Zoom every couple of months, or I'd like shoot them an email here and there, like not bothering them, because that's annoying, respecting their time, but also just kind of asking for advice and just really trying to understand whether they thought that I was going in the right direction, and so that they could just guide me down the right path. You know, look to those who are more successful than you to give you a helping hand, and people will be very touched that you want their advice for sure. So that's a little tip. And then what do I do on a day-to-day at work? Well, it's so varied. Obviously, having my own business, I wear all the hats. I'm so thankful that I get to work with patients on a regular basis to really elevate their health, whether that be they're going through cancer treatment, or they've got cardiovascular disease, or they just want to lose weight. I get to treat them in a way that is personalized to them, so that makes me happy. I'm involved in the research kind of side of things, which is really fulfilling, and you're always continuing to learn. That's a really great tip as well, never stop learning. And then I also teach other practitioners to actually use genetics and nutrition within their practice. So the University of Toronto have trusted me with their education of other practitioners within the universe, within the kind of Europe, which is really exciting. And I also now speak at conferences as well in the area of personalized nutrition. So I kind of speak to the public about it in kind of layman's terms, and I also speak with biotech companies as well around the science of nutrition and genetics. And I also sit on the advisory board for a couple of biotech companies as well, just really guiding them to what they should be doing and what is evidence-based, because that's what we do as registered dietitians. We practice with evidence-based, and yeah, we protect the public. So that's what I do on a day-to-day basis. If you want to follow me and what I get up to, you can follow me at the DNA Dietitian with a T, not a C, on Instagram, and I talk about wellness, health, genetics, and obviously what I'm doing on a day-to-day basis. So that's a really great way to connect. And if you do connect with me through that, just send me a little message and say that you're from CRGS. I will be, really happy to say hello. So good luck, everyone.